So I wanted to thank everyone for coming today, and we're thrilled to be here to celebrate the 125th anniversary of the Johns Hopkins University School of Medicine. It's really a pleasure to be here today, and before we begin, I wanted to thank a bunch of people who are responsible. First, I want to thank Governor Hogan and Mayor Pugh for taking time out of their really busy schedules to be with us today. I wanted to thank the Alumni Events Team, the 125th Anniversary Planning Committee, the Johns Hopkins Medical and Surgical Association for planning these events during this week. I'd like to thank leadership of both school medicine and the health system for helping today, the faculty, students, and staff of this institution that makes it a pleasure to be here every day at Hopkins. And of course, we have a lot of our distinguished alumni here today and who've come back for the Home to Hopkins weekend. And thank you for helping us celebrate. Today's symposium is one of a series of events we've had over the year and will have during the year to help celebrate it. We kicked off, the first one was in January, where we celebrated Mary Elizabeth Garrett and named the boardroom, the Mary Elizabeth Garrett Boardroom. And where's Kathy DeAngelos, who it was a great idea to do that. Kathy, I will thank you again for doing that. For those of you who don't know, Mary Elizabeth Garrett was a prominent feminist and philanthropist who used her philanthropy to change the country and certainly changed medicine. She was the largest donor that began this School of Medicine 125 years ago, and she used it to really change the way American medical education occurred. She said, I'll give you the money on two major criteria, one of which is that men and women had to be accepted on the same criteria. We were the first med school in the country to do that, and only the second med school to admit women and men. In addition, she said that she wanted to get out of medicine being a trade school, and she said people who were admitted had to know 3 languages and really have graduated college. And at the time, people were skeptical. William Welsh, the first dean, was quoted as saying, "It's one thing to build an educational castle in the air and another to face its actual appearance under the existing circumstance." He didn't think anyone would show up. He was wrong. In 1893, 18 students matriculated, 3 of which were women. The next year, they doubled enrollment. These early graduates soon became the leaders of American medicine, and it took off from there. The framework that they built were hands-on learning in the lab and at the bedside, a curriculum grounded in science, the marriage of research and patient care, rests on principles that have endured for a century and a quarter. Yet with this new knowledge and new technologies at our disposal, we are constantly refining how we teach and practice medicine, and you'll hear from Roy Ziegelstein today. So it's so fitting that the anniversary has a theme of when tradition meets innovation. We have so much to celebrate. Our medical and graduate school programs are among the top in the country. Our med school is ranked 2 and should be 1, but you know, it's random, I guess. Our faculty are really among the leaders in the world in so many fields of education, clinical care, and science. It's a truly unique place. We have Mike Johns. We just gave the Mike Johns lecture, and Mike just talked about how there's just something special about Hopkins. It is a unique institution. I've been here 6 years, and it's the only medical center I know where the word cure is used, not randomly, but often, because that's our goal, is to cure human suffering and human disease. And for me, I am just honored to be here, and it's really an honor to be here for the 125th today to celebrate really one of the great institutions in the world, which is the Johns Hopkins School of Medicine. Among great leaders and great people, it's really my honor to now ask the president of the university, Ron Daniels, to come up. Ron?
Thank you, Paul, for your leadership, for your partnership, for your inspiration. I have to say, Paul, just on the way over here, and knowing you were going to call on me, I had this moment of dread terror when I realized I'm coming to an anniversary party and I have brought no gift for the 125th anniversary. And so while you were speaking, I was listening and rapt attention to every word you said, of course, but I was double tasking. And I was trying to go through the list of, like, you know, if you Google anniversary gifts by year, to my surprise, it runs out. It starts off, as you know, first is paper, plastic, and clocks. But it runs out, surprisingly, at 80, which just says diamond. And I know, Paul, you and your colleagues are working on finding innovative ways to extend our lifespan, so we'll have more to worry about. But I was thinking in this moment of what we could do that would really be meaningful to you and to colleagues here at Medicine. And the only thing I can say is, Paul, I know that you are passionate about more research space for the Johns Hopkins School of Medicine. And of course, the university understands that and will do everything it can to support the amazing leadership and the philanthropic support that you have enlisted from various folks to make your next building happen. So I think that's actually a reasonably good proxy for the diamond stuff that we were talking about earlier. Good afternoon, everyone. It's great to be here with all of you, with distinguished guests, Governor Hogan, Mayor Pugh, of course, along with the leadership of Johns Hopkins Medicine, including Kevin Sowers, Redonda Miller, and of course, Paul Rothman, our Dean and CEO. Now, during the era in which he was the founding Dean of the School of Medicine, William Welch was a much sought-after public speaker. And on one occasion, while he was giving what I can only assume was an absolutely scintillating talk on diphtheria, which, as you know, was a specialty of his, at a particularly formal gathering, he suddenly, just 1 minute into his remarks, pushed aside the sheaf of papers on the podium and announced that he would be delivering his talk extemporaneously. Now, after he had finished speaking, he hurried from the room, and in his haste, he forgot to take his prepared remarks with him, and he left the speech on the podium. And one of Welch's future biographers was present for the event and furiously dashed up to the podium. What a boon for research. A trove of material in the author's original hand, he thought, delighted to be able to preserve the great doctor's words for posterity. So he picked up the pages and scanned the first paragraph that Welch had read aloud. Then he looked for the second paragraph. He leafed through all the pages and never found it. Every single one of the pages, save for the first page, which had the first paragraph, was absolutely blank. Now, Welch had obviously improvised the whole talk on diphtheria without working from a script. And we are told, unsurprisingly, he acquitted himself beautifully. Of course, though, Welch, together with the other founding doctors, did exactly this with the Johns Hopkins School of Medicine. Like the university of which it is part, the School of Medicine took an idea for which there was no formal blueprint, that a state-of-the-art School of Medicine could be integrated into a hospital and a larger university community, and transformed it into one of the world's great institutions of medical education. This was a place designed to partake of the habits of thought and the objectives of the broader university, America's first research university, which of course was created through Hopkins' will. A place populated by students and faculty who would embody the methods of disciplined reasoning and what Welch called the spirit of investigation to yield radically new ways of seeing the most difficult medical problems. A place in which all of these qualities would be harnessed under the service of the school's ultimate design, which was, as Welch put it, nothing less than, quote, the relief of human suffering and the advancement of human welfare. Long before the School of Medicine opened its doors to students, Welch envisioned an institution where laboratory instruction and clinical teaching would replace didactic lectures, where research would be conducted in hygienic labs equipped with cutting-edge equipment, and where ambitious faculty would be co-creators of this vision, training generations of independent scientific workers. And then he went off to help build it. From this germ of the idea, Welch grew an institution gathering around him in record time, in fact, the best and the brightest faculty from around the country and cohorts of students who had to meet Mary Elizabeth Garrett's lofty admissions requirements, which Paul referred to a moment ago. These men and women were drawn to Hopkins by the promise of harnessing curiosity, inquiry, and discovery in the service of improving human life. It was an ethos, of course, that led Abraham Flexner in his famous 1910 report on the state of medical education in America to hold up Johns Hopkins as the very model of medical training against which all other university medical schools in the United States and indeed internationally should be judged. Johns Hopkins was, from its earliest days, the standard. In that report, Flexner praised Hopkins' embrace of the scientific and theoretical dimensions of medicine. But later in his life, he began to fear that too much of the emphasis on the empirical could become the enemy of the human, that this would somehow subvert the core humanistic mission of the school. And he need not have worried. The Johns Hopkins School of Medicine has never lost sight of the deeply humane objectives that Welch and his fellow founder and successor as dean, William Osler, committed to 125 years ago, to pursue discovery with a focus on the patient. From this core principle, on the focus on the patient, have emerged discoveries ranging from the targeted use of radiation to treat cancer, to the science underlying modern pregnancy tests, to the creation of the field of medical genetics, which now provides the foundation for our Genes to Society curriculum, the embodiment of the school's commitment to reimagine medical education for the 21st century. Each of you, our alumni who've come home to Hopkins this weekend, including those of you who we are delighted to say have never left us, together with our faculty and staff, have played an integral part in medical education, research, and practice that is the Johns Hopkins School of Medicine. Thank you for helping us to articulate and fulfill Welch's vision for this great institution and to set in motion the next 125 years. Thank you for creating a part of the university that casts a broad halo and an aura across all of our university and adds so much strength, so much accomplishment to the luster of Johns Hopkins University. With that, it is now my great privilege and pleasure to introduce our Mayor, Catherine Pugh. Throughout her tenure, Mayor Pugh has been an invaluable partner in her commitment to serving the city and its many communities. She understands perfectly our university's mission, as well as the historical importance of anchor institutions like Johns Hopkins University, Johns Hopkins Health System, Johns Hopkins Medicine, of course, and understands the contributions we can make to the city of Baltimore. And she has been relentless in her focus on improving the welfare of the city. We look forward, Mayor Pugh, to working closely with you as you bring your great inspired leadership to the city of Baltimore, and just so pleased that you're with us today to speak to our alumni. Thank you.
So Ron, I too went through that list of 1 through 80 and decided that there wasn't anything there for 125, so I thought I'd bring my little plaque. So would you please come and accept? This is my salute to Johns Hopkins University and the School of Medicine for 125 years of just great and wonderful service to our communities and for all the innovation that has taken place at this university and this hospital system. Thank you so much.
Thank you.
Allow me a moment just to say thank you to President Daniels for your kind introduction. I feel as the mayor of this city that I could not have better partners than Johns Hopkins. You have been innovative, you've been creative, you've been supportive, you've introduced me to folks that I would probably have not normally run into, certainly not just on the streets of Baltimore, but one who has become a mentor and quite a friend, and that is Mr. Bloomberg, who has added so much, and so has this institution, to my leadership of Baltimore City. So I want to say thank you. I'm just so glad to be here with so many exceptional leaders in medicine and science, and so I want to say thank you to Drs. Radonna Miller and Paul Rothman for your vision and for all that you do to improve the health here in Baltimore and around the world. And to my partner in government, Governor Larry Hogan, thank you, Governor, for championing health and well-being and for being such a great partner. You know, there's always been conversations and people will say, well, how do you get along with the governor? And I can tell you he's been an exceptional partner. When I think about coming to you early in my administration and saying, I need X amount of dollars to help improve violence reduction in our city, and you were there for me and for the citizens of Baltimore, thank you. It is an honor just to be here, thank you. To celebrate this 125th anniversary symposium with you all. I can't imagine what the next 125 years are going to be like. I am proud to lead a city that is home to this world premier institution for higher education, including the Johns Hopkins University School of Medicine, right here. You developed, as you well know, renal dialysis, completed the first successful open heart surgery on an infant, developed CPR, and formed the basis of the biotech industry. These are incredible innovations. They build upon powerful traditions that are exemplified in the collaboration between medicine, science, and public health. We all know that Baltimore has never taken a back seat to healthcare advances as it relates to public health. Baltimore City has one of the oldest health departments in the country, founded in 1793 and being led by an extraordinary doctor, Dr. Leanna Wynn, our health department. With our partners across the city, we have championed, you all have championed innovation to complex issues, including needle exchange, to stop the transmission of HIV and hepatitis that our communities grappled with for so long, and programs to reduce opioid overdose deaths. The Johns Hopkins School of Medicine has been an exceptional partner to the health department on multiple initiatives, including Vision for Baltimore, which offers eye exams and glasses to all of Baltimore City Public School System children, students who could not afford and parents who cannot afford eyeglasses for their children. I am so grateful, and I know Ron and you all have had such a great hand in making this happen. I wish you all could have seen the smiles on the parents and the looks in the eyes of those children when they put on those eyeglasses and realized that they were not handicapped by any means, but they just could not see. Those eyeglasses have made the difference in their future, and now we know that they too will become very productive members of our community. It is a public-private coalition of more than 100 partners across the city with the goal of ensuring all of our Baltimore babies are born healthy with levels of care. And that's our initiative that we work with you on Be More Healthy Babies. In Baltimore, we see health as a critical lever for social justice, and it takes an all-hands-on-deck approach to tackle some of our city's most challenging issues. I thank the Johns Hopkins School of Medicine and the state of Maryland for being terrific partners in this effort. As you all know, I constantly impress upon all of our agencies and partners in the city that collaboration is essential as we work to make Baltimore a healthier city for all of our residents, regardless of where they live or their station in life. It takes all of us working together to achieve our goal of a safer, healthier city. I congratulate the Johns Hopkins University School of Medicine for your tradition of excellence and a track record of innovation. I encourage you to continue to be innovators in science and medicine, and continue your critical partnership with us. Let me challenge you also. I'm talking about this medical community, the science community, your researchers, your health system, as we tackle one of America's greatest problems that not only grips our city, but grips the state the country, and the world, and that is opioid addiction. Let us continue to work towards more innovative ways for treatment, utilizing telemedicine in areas of mental health and the use of methadone that don't devastate neighborhoods, but provide dignity for the patient and wholeness for our communities. You set the stage as a renowned medical research system and health institution. Continue to lead. Continue to push and encourage your students and doctors through their research to find sustainable solutions for today's medical crisis and tomorrow's challenges. Thank you. Congratulations. Happy 125th. Thank you.
Thank you, Mayor. You know, when President Daniels was trying to think what the 125th could see, I was thinking, how can I get some real resources out of the Institute? So I decided that the 125th is going to be the Bitcoin anniversary. It's a real pleasure to introduce Governor Larry Hogan. You know, Governor Hogan was elected in 2015, only the second Republican in 50 years to be elected governor of the state. And I can truly say that in his time there, he's demonstrated to be one of the great leaders in this country. His initiatives, if it comes from transportation to opioids to education, has really changed this state. He, I think, has bipartisan support for what he's able to accomplish here. And for me, it's a real pleasure to introduce Governor Larry Hogan.
Thank you all very, very much. Good afternoon, everyone. It's great to be here with you. Thank you, Dean Rothman. That was a kind introduction. I want to extend congratulations to you, to President Daniels, Dr. Thompson, and the entire Johns Hopkins University School of Medicine team on reaching this incredible milestone of 125 years. Now, I have a bunch of prepared notes here, but Ron Daniels gave me a good idea. I'm thinking about just extemporaneously giving you a dissertation about diphtheria, right off the cuff. But I'm not sure I'm qualified for that, but probably should stick to the notes. I also want to recognize your new president of the Johns Hopkins Health System and executive vice president of Johns Hopkins Medicine, Kevin Sowers. Just this year, Kevin moved to Maryland after many years at this small school called Duke University. And I have no doubt that he's going to help us build a stronger health system. So welcome to you. Since 1893, the JHU School of Medicine has fostered a legacy of innovation, leadership, and discovery. It's helped to change the way medicine is practiced and advanced here in Maryland, across the country, and really throughout the world. Johns Hopkins pioneered the study of neurosurgery, psychiatry, pediatrics. It was Johns Hopkins that a cancer patient named Henrietta Lacks became the source of the very first immortal cell line in history. Last year, August 1st of last year, we declared Henrietta Lacks Day in Maryland on what would have been her 97th birthday. There have been major advancements in cancer treatment, and I was honored to participate in the opening of the Bloomberg Kimmel Institute for Cancer Immunotherapy. JHU has been responsible for so many important breakthroughs, the live kidney donation, stem cell research, among many, many others. And throughout its history, Johns Hopkins has transformed medical education, research, and the way that medicine is practiced. And its impact and its footprint here in our state of Maryland is staggering. Johns Hopkins is the largest private employer in the state of Maryland. with world-leading institutions, including a leading university, Johns Hopkins Medicine, a health system with 6 hospitals, a health insurance company, the world-renowned Applied Physics Lab, a technology transfer office that reflects the robust inventions and discoveries of faculty members, laboratories that spin out innovative company after company, and so much more. All of these assets within Johns Hopkins contribute immeasurably to our state in countless ways, including economic development and innovation. By the way, we were named the most innovative state in America, but across leading industries. And this unmatched leadership is a key reason why I named President Ron Daniels as the co-chair of our comprehensive statewide economic development strategy called Excel Maryland, which is focused on new collaborative strategies to accelerate growth in biohealth and the life sciences and cybersecurity industries. At Johns Hopkins Medicine, we see talent, compassion, empathy, and humanity of Marylanders hard at work every day to deliver miracles to people in need. As a former patient going through cancer in today's healthcare system, I know firsthand, and I'm very proud to support JHM's mission-driven approach of teaching, research, and patient care. And it truly is an honor to have this opportunity to be with all of you for this incredible celebration of 125 years. The state of Maryland is proud of our strong partnership with Johns Hopkins and our continued collaboration with you on health priorities. As you know, we were recently successful in finalizing our unique, innovative total cost of care Medicare model contract. This patient-centered approach will expand healthcare access and affordability and ultimately improve quality of life for our citizens, particularly those with chronic, complex medical conditions. It will incentivize hospitals to work cooperatively with providers, nursing homes, clinics, and other parts of the healthcare system to control healthcare spending overall. So I want to thank you and all of our hospitals here in Maryland, as well as our Secretary of Health, Bobby Neal. This was a tremendous team effort and quite an accomplishment. We also recently enacted landmark legislation to stabilize the individual marketplace to prevent massive insurance rate increases for Marylanders. As you know, increasing rates have been a problem for about a decade now. There have been massive changes to health care in Washington, and these problems haven't been resolved at the federal level. And so in Annapolis, we decided to take action ourselves. We addressed this crisis head on to protect Marylanders from facing 50% or more increases in their monthly premiums. And we remain committed to developing a long-term fix for market stability over the lifetime of the waiver and continue to work closely with our federal partners on this important issue. Our administration is working hard to promote and improve lifelong health and wellness in our rural communities. 15 of our state's 24 jurisdictions are considered rural areas, and we must work together to remove the gaps, and eliminate barriers to these in these rural communities. To help increase the number of providers and ensure better access to care, we're streamlining incentive programs like the state loan repayment program, the J1 waiver program, and the preceptor tax credit program. We're also working hard to address what I believe, and Mayor Pugh mentioned this, the #1 health crisis, I believe, facing our nation. One of my first acts as governor was to establish an emergency heroin and opioid task force. And we got input from people all around the state and all around the country and the world. We immediately implemented nearly all of their comprehensive recommendations, which focused on a 4-pronged approach of education, prevention, treatment, and enforcement. I became the first governor in America to declare a state of emergency on this particular issue. And we decided that we needed to address it just like we would any other major crisis, any other natural or man-made disaster. We've already allocated more than $600 million in state money to addressing this crisis, this heroin and opioid and substance abuse problem. This past year, we increased, in fact, doubled the crisis treatment services and care coordination. We piloted the first crisis stabilization center. We expanded screening, brief intervention, and referral to treatment, an evidence-based tool that helps identify patients who are at risk of substance abuse disorder. We expanded that to 6 detention centers, 5 additional hospitals, and we worked with all 9 of Maryland's Medicaid health choice managed care organizations to reduce opioid misuse, dependence, overdose, and death in both Medicaid fee-for-service and health choice managed care programs. And on July 1st, our new and improved prescription drug monitoring program goes into effect. In spite of all of these efforts, and the efforts on the part of many of you here in this room, the efforts of the city and our hospital partners, in spite of all these efforts, nearly 2,000 Marylanders died from overdoses just last year. That's more than all of those killed by firearms and motor vehicle accidents added together. And the good news is that our collective efforts have started to bend the curve downward for the first time ever in prescription opioid overdoses. We bent the curve downward on heroin for the first time ever. I'm not sure too many other states are doing that. But a new and much more deadly synthetic is growing out of control across America. Fentanyl. Overdose deaths in Maryland are up a staggering 70% just last year. And as this crisis evolves and grows, so must our response to it. Ultimately, this is about saving lives, and it will take a collaborative, holistic approach with our federal, local, academic, and private sector partners working together to achieve that. All of you in this room know better than most that healthcare policy, finance, and delivery of care for patients is complex, hard work. The work that all of us are doing touches the lives of Marylanders in countless ways. With a common vision and mission, we can continue this course of providing the best access to care in the nation and the world. I look forward to our continued collaboration on these and many other issues as we work together to improve the health of our state and as we continue to change Maryland for the better. So congratulations once again to all of you, to the Johns Hopkins University School of Medicine on 125 wonderful years. And at this time, I'd like to invite Dean Rothman, President Daniels, and Dr. Thompson to please come forward so I can present them with an official governor's citation. I don't know where that is. Here it is.
Well, we had actually planned to give Governor Hogan a gift, but we found out that this violated Maryland state rules. So I'm sorry we can't do this, but we have to keep our politicians clean. So at any rate, I'd like to transition now to a video which I believe that all of you will enjoy watching. It's a great summary of Johns Hopkins and everything we've been through in the last 125 years.
Few institutions can claim to have been there at the birth of modern medicine. And while Johns Hopkins' impact reverberates around the world, its genesis began with the stroke of a pen in 1873, when a gentle Quaker man put his vision into a letter that would inspire and heal generations to come.
In all your arrangements, you will bear constantly in mind that this is my wish and purpose, that the institution shall ultimately form a part of the medical school of the university.
A medical school that would redefine how medicine was taught and practiced, and would redefine who could study and practice.
And inasmuch as my interest is in the medical education of women, They shall enjoy all the advantages on the same terms as men. And the medical school shall form an integral part of the Johns Hopkins University, providing a 4-year course leading to the Doctor of Medicine.
Throughout its 125-year history, advances and breakthroughs continued to revolutionize medicine. Diseases previously pursued under a microscope are viewed today through a much broader lens, wide enough to examine the scope of patients' experiences, genetic predisposition, and access to care. Information and data so vast and revealing, the result is targeted therapies and cures that our founders could have only dreamed of. The vision embodied by the first class of 18 students paved the way for thousands more to follow. Pioneers all, physician scientists devoted to research, clinical care, and educating the next generation. And as our understanding has grown, so has our reach. Collaborations in nearly 100 countries are fulfilling the destiny set forth 125 years ago when Johns Hopkins committed to his vision of serving the community. Today, our community is the world. Congratulations on staying the course and providing hope for humanity.
Good afternoon, ladies and gentlemen. I'm Roy Ziegelstein. I'm the Vice Dean for Education in the School of Medicine, and it's really a pleasure to give you an update on the School of Medicine, particularly on medical education. So I want to start by showing you a picture that is about as old as the School of Medicine, but isn't the School of Medicine. It is a church that some of you may know in Barcelona, Spain, called Sagrada Familia. How many of you are familiar with this church? So what is distinctive about this church is not only that it was started around the time that the School of Medicine here in Baltimore was built, but also that it's a good symbol from my perspective because its architecture continues to the present day. Basically, every generation has built on Gaudi's original plans. And so if you go today to Sagrada Familia, you'll see cranes as the church continues to be built by the current generation. That basically is how I feel, and I hope how you feel about the School of Medicine. It's something that was built 125 years ago, but everyone in the room, and in fact future generations, will continue to build on the greatness that is Johns Hopkins School of Medicine. It turns out that all through the ages, our graduate students, medical students, residents, and fellows have pursued excellence. And while we think about the past and the future and the differences, those are similar values to what our trainees and students have today. I want to provide you an update on just 5 or 6 highlights of what is going on in the School of Medicine today, and would love the opportunity to talk to any of you anytime about more details. This is actually a picture of my internship in the Osler Medical Service. If you're really good, you'll be able to pick me out. I want to point out by showing you this picture that we have greatly increased our diversity. In fact, when I joined the Osler Internal Medicine Residency Program in 1986, when I was only 4, about 1 in 6 interns was female, and very, very few were of color. In case you're interested, I'm in the 2nd row from the front, 3rd from the left, standing next to 2 other women to my right and 2 from me. And as you see, I have not aged a day. Today's class, intern class and residency class in the Osler Medical Program is much more diverse, many more women, many more underrepresented minorities. That's one highlight I want to point out. And our medical school class is almost every year, about 50% women, sometimes a little more. In fact, in the next segment, when we have our panel discussion, you'll hear from 2 women who are alums of our school, separated by some years, mother and daughter. Second, our medical curriculum, our MD curriculum, has evolved. The Genes to Society curriculum that you are either very familiar with or at least have heard about emphasizes that health and illness is not a dichotomy, but rather a spectrum that's influenced not only by an individual's genetic and biological makeup, but also by the environment. There have been extraordinary changes in what we teach our students today compared to a generation ago. Finances of United States healthcare, health policy and economics, the science of healthcare delivery, high-value care, team-based care, patient safety and quality, the care of special populations, for example, LGBTQ populations, health disparities and social determinants of health, population health. These are topics that I learned nothing about in medical school. And now it's part of the standard curriculum here at Johns Hopkins. And in our next segment, again, on the panel discussion, you're going to hear from a father and daughter, and we'll hear a little bit about social determinants of health, one of the interests of one of our current students. Third, we have responded to the nation's need to train leaders in primary care, something that we really did not do in the past. The primary care leadership track in the medical school, led by Dr. Colleen Christmas, enrolls about 10 students every year near the end of their first year of medical school to a 3-year experience. This is a picture of our newly minted students at this year's induction in April. These students are assigned to special primary care sites where they have value-added roles earned from participating in workshops and continue to work at their clinical sites over the course of 3 years. They have a lot of exposure now to primary care, and they develop deep relationships with their patients that were absent certainly in my generation when I was a medical student. Further, they conduct scholarly projects in primary care and have primary care mentors. It's in the 3rd year running, and so we really don't have any not only long-term but even short-term measures to share with you, but I think that most students would say today that it has transformed the culture of Johns Hopkins Medicine. And again, in our next segment, you will hear from one of our panelists, Awasana, who is a student in that track. Fourth, we now teach residents about the importance of delivering care of the highest quality at the lowest cost. When I was a student and when I was a resident, we really did not consider cost. But we have to consider cost, and we owe it to our trainees to teach them about the importance of high-value care. Not only are our students and residents educated about costs of care and the importance of judicious use of medical tests and treatments in an effort that's led by Drs. Pam Johnson, Amit Pawa, and Lenny Feldman, and others, but they also actually participate and lead quality improvement work and efforts to reduce unnecessary tests and procedures. In fact, at this point, one could say that Johns Hopkins is really a national leader, not just a participant in high-value care. As you see here in an article featured in our dome, we really involve and engage our residents and students, and as you'll see on the bottom right, we now sponsor a national symposium. This year it will be on September 21st to 23rd at the Baltimore Convention Center. And for those of you that are interested, it would be a great opportunity for you to be involved in high-value care and see what efforts we're leading here at the school. Fifth, we're changing the way PhD students in our school are taught. In the past, graduate students started at Hopkins with their coursework. They then tried out different labs, eventually selecting a lab and their thesis mentor. And they then began to work on their PI's project with the goal of being able to graduate, get a postdoctoral fellowship, and hopefully eventually a tenure-track faculty position. One could say that that standard way of teaching PhD students in the biomedical sciences really hasn't changed for essentially for 100 years. But it turns out that while academia, discoveries of basic mechanisms and fundamental science will always be important pathways to excellence, and while Johns Hopkins will continue to add to our legacy of training Howard Hughes investigators, Lasker Award winners, and Nobel Prize recipients, it turns out that today many important discoveries are made in the biopharmaceutical industry. In addition, changes to the biomedical workforce landscape have reduced the percentages of PhDs entering academia. A generation ago, at least half of all PhDs in the biological sciences obtained a tenure-track academic position, and now it's 15% or less nationally. Under the leadership of Dr. Peter Espenshade, our Associate Dean for Graduate Biomedical Education, we launched the Biomedical Careers Initiative in 2013. The Biomedical Careers Initiative provides information and facilitates training and networking for the broad range of careers available to PhD students upon graduation. Since its inception, the Biomedical Careers Initiative has helped now more than 60 School of Medicine students secure internship positions in industry and also in science, writing, and consulting. Other students who are interested in research careers in industry can take advantage of a brand new, first-of-its-kind program, a partnership between Johns Hopkins and MedImmune. For those of you that don't know, MedImmune is a global biologics research and development arm of AstraZeneca, whose office is here locally in the state of Maryland. Students in this joint program between Johns Hopkins and MedImmune are mentored by a pair of co-supervisors, one at Johns Hopkins and one at MedImmune. In addition to the standard Johns Hopkins course curriculum and PhD thesis project, students are introduced to the processes and challenges of drug discovery and development through coursework in translational research, as well as laboratory research at MedImmune under the direction of MedImmune co-supervisors. Here you'll see quotes from two of our participants in the program. I'm not going to read them, assuming that you've already read them while not listening to me. The most recent example of innovation in biomedical science education in the School of Medicine is one that hasn't started yet, but will start soon, and that's a cross-disciplinary graduate program in biomedical sciences. We call it XD Bio for short. XD Bio will begin as a small pilot program with just 5 students in the fall of 2019. Students in this program will have 2 mentors from different scientific disciplines. Their curriculum will be personalized to their needs, not a generic curriculum for all students. They'll begin laboratory work on day 1, and full funding from the School of Medicine for 5 years will uncouple their research from faculty grant funding. Finally, I want to talk about medical school financial aid and what is being done for our pipeline here at Johns Hopkins. I want to start with what I would consider to be a startling statistic that many of you in the audience may know, but some may not. There are now fewer African American male matriculants to medical school than in the 1970s nationally. I'm going to say that again. There are fewer African American male matriculants to medical school in this country today than in the 1970s. We need to provide opportunities to change that landscape, both here at Johns Hopkins and across the country. It turns out medical school, this is not a shocker, is expensive. The average cost of attending medical school across the United States is now more than $300,000. Not surprisingly, this cost is prohibitive to many prospective students. What may be surprising to you is that despite this rising cost, there is evidence that more and more students are graduating not only with higher debt on the one side, but more and more are graduating with no debt. In fact, 27% of students nationally now graduate with no debt, compared to just 16% of students 3 years ago. What that means, we believe, is that medical school may be becoming, unfortunately, even more a program for the rich. We don't want that in this country, and we certainly don't want that at Johns Hopkins, so we really focus on financial aid, and especially need-based aid for our students. There are compelling reasons to diversify the physician workforce related to race, ethnicity, and socioeconomic status. We are absolutely committed to all aspects of diversity, and we're proud that the debt of our students who graduate with debt is actually in the lowest decile in the country. But again, we need to do even more. We also have pipeline programs that I want to just orient you to. These pipeline programs help socioeconomically and educationally disadvantaged high school and college students who are offered opportunities here in our research laboratories at Johns Hopkins. Through the efforts largely of Dr. Douglas Robinson in the Department of Cell Biology, we have built the Johns Hopkins Initiative for Careers in Science and Medicine. In fact, Doug Robinson just won a Provost Award for Diversity a few days ago. This program, the Careers in Science and Medicine, serves about 60 students a year from high school through post-baccalaureate levels from all over the United States. All students come from low-income backgrounds and are generally first-generation college or from high schools where a large percentage of the student body are on free or reduced-cost meal programs. The high school students in this country largely come from Baltimore City. 84% of those individuals, 84% have reached college and matriculated into four-year college programs, 84%. About 4 of 5 of those students have gone into science, technology, engineering, or mathematics. Our most senior graduates of the program have been accepted in a wide range of universities for MD and PhD programs, including here at Johns Hopkins, and also at Stanford, Harvard, Vanderbilt, Brown, Einstein, and many more. Here is a picture of some of the participants in our program, and I would welcome you to the CARES Symposium that will be in July, at the end of July, which features our summer students. So with that, I want to transition now to a video, which by magic will appear on your screen.
They called it revolutionary, a method of teaching medicine that imposed rigid entrance exams, incorporated science, laboratory research, and bedside instruction. Johns Hopkins medicine was way ahead of its time in 1893. Fast forward to 2018, a much different world, with much different challenges. And, in some ways, a much different, but still revolutionary approach to medical discovery. The School of Medicine admitted women from the time its doors opened in 1893. Today, Hopkins has graduated 2,543 women. Johns Hopkins decreed that services would be provided without regard to sex, age, or color.
In fact, the second patient to receive services after the hospital opened its doors in 1889 was African American.
Today, about 1 in every 5 medical students at the Johns Hopkins School of Medicine is an underrepresented minority.
William Stewart Halstead, the hospital's first surgeon-in-chief, is widely credited as the first to develop and introduce rubber surgical gloves in the United States.
Today, we use these. In 2017, the hospital purchased 103,066,199 of them.
The tools we used for medical discovery have come a long way. A century ago, that meant concentrating on the causes of disease.
But nowadays, with new advances like CRISPR, we can actually manipulate and edit genes to treat or even prevent diseases.
Johns Hopkins Medicine blazed new trails with its medical curriculum. Back then, students learned about normal and abnormal biology and physiology.
Today, we learn the full spectrum of healthcare, including how it is impacted by our genes and our environment. Medical students learn this firsthand through volunteering at community sites like this.
Back in 1893, residents lived together in one spot.
Today, we live all over the city and only work 80 hours a week.
Here's a fun fact. William Osler used to require his residents and trainees stay in the hospital so they were closer to their patient. That's where the term residents come from. I guess some of us still need our beauty sleep.
In 1893, the School of Medicine had not one single building dedicated to teaching.
Today, this expansion of our medical campus looks like this. Fun fact, when the Science and Technology Park is fully built out, it'll be 1.1 million square feet of space.
One thing that has never changed is that PhD students have access to great facilities and great scientists.
And there's another important tradition at Hopkins that continues today. From the very beginning, students, residents, and fellows cared deeply about their patients.
And now, 125 years later, medical students, residents, and fellows still care deeply about their patients. Some things just don't change.
Johns Hopkins Medicine, where tradition meets innovation. Yesterday, today, and tomorrow.
So you can see we've shifted to another segment of our program. This is going to be, I think, a very interesting panel discussion where I'm the moderator, and you will hear from pairs. We have 6 people, 3 pairs here, who will interview actually each other with the thought of then and now. Our first pair, father and daughter, Peter Green and Sarah Green Gensheimer, are going to talk a little bit about their career paths. Peter and I were at a dinner the other night. We socialized from time to time, and he made the comment that social determinants of health, which I touched on in my talk earlier, were something that we really didn't learn when we went to medical school. And his daughter is actually pursuing that as her career passion. Peter and Sarah?
Sure. Roy, thanks, and what an honor for both of us to participate, and thanks for allowing me to fully legitimately be a proud dad for a symposium, so thank you very much. Actually, I wanted to start with Home at Hopkins has a special meeting when you're born to 2 residents at Johns Hopkins. So, Sarah, what in the world was that like?
Hi. Do people know our backgrounds at all also? Okay, hi. I'm Sarah Green Gensheimer. I'm an MD PhD student here, 4 years into the dual degree. I'm doing my PhD at the School of Public Health, and just a week ago got released into dissertation world, trying to figure out what I'm doing with my life. Dr. Ziegelstein, though, knows my life passion already, so I'm glad he does, and I'm still working on it. I guess...
Sure. I'm Peter Green. I'm Chief Medical Information Officer for Johns Hopkins Medicine, and I've been here for 33 years and trained in cardiac surgery and worked with Bill Baumgartner, and who's being celebrated later today, for that entire time.
So talking about being the kid of 2 residents at Hopkins, so you and Mom both trained here, I have to be honest, I thought medicine was the worst career to ever go into. I did not understand why anyone would do it. You never slept. And I remember as a kid, actually it's kind of a fond memory, when you would get called in to go into the hospital at night, I would crawl into your side of the bed, which was warm and cozy, but I guess that also means you weren't there at the time. So I remember thinking, wow, Mom, Dad are off doing something really amazing, but they aren't here. And this seems like a really demanding career path. And I also remember admitting to you all, I think on a family vacation, that I was going to go to medical school, and it was like admitting a guilty pleasure. I couldn't believe that I had decided to take the same path.
So we were absolutely delighted to hear that, and ringing in our ears was concerns about how busy life was. But we were absolutely delighted as well when you decided to come to Hopkins and you got into a bunch of other medical schools what made you come here?
Yeah, heading into the process, I mean, a lot of people here have applied to medical school. You just apply and you say, "Ooh, hope this works out." And when I got into Hopkins, I wouldn't have said this at the beginning, but I knew immediately this is where I wanted to go. In no small part because I knew you were here, and I knew Mom was in Baltimore as well, both of you in healthcare. And I thought it would be incredible to come back and in some ways feel like I get to work with you, although right now I mostly work with my books. So that was a huge part of it. And another part was when I visited the campus, it was just such a warm and inviting place, and that was exciting to me. But the biggest piece at its core, I grew up in Baltimore. I was a kid of 2 Hopkins residents, and so this was both coming home and the chance to work with and learn from a community that meant so much to me, and that really I felt that I couldn't imagine a better place to get my medical education when I thought about who I wanted to be as a healthcare provider. Dad, why did you come to Hopkins? He wants to ask all the questions, and he has like a list in his hand.
So I got invited by Duke Cameron, who was the prior surgeon in charge here, to come down for a sub-internship. And it so happened during the month that I was there, Bruce Wrights and Bill Baumgartner did a heart-lung transplant. And it was done incredibly effectively, and I was just in absolute awe of this place that you could do that. And they did it with such professionalism. It was just an absolutely inspiring place. And every day I've been here, I've been amazed at what amazing people come here, and what a great honor it is to be here. So Roy mentioned that although we learned an awful lot of surgical procedures and we tremendously good at diagnosis here, amazingly to our public health colleagues, we really didn't understand even what social determinants of health were. I think we maybe documented them in certain parts of the history that we took, but really they didn't impact in the way that we've been taught they should. What is it that got you interested in that topic?
Yeah, this is an interesting question to me because in my world, and I'm sure plenty of people here view it as a given. It's not so much an interest as an imperative to be thinking about other factors besides healthcare that affect someone's health, like their income, their food security, their housing status. And you were relaying this story of we didn't really think about it, and I'm having trouble understanding what that means. Every single one of my classmates at the School of Medicine are thinking about this. When I had the chance to do a rotation in the hospital, and it's become a topic of conversation, if it wasn't before, in terms of thinking about what can this patient afford, or how is this person actually going to do this at home if we prescribe X, Y, or Z. I'm interested, like what was it like 30-something years ago, when you were, both when you were training and then, of course, you went on to practice after that.
So I think there's an awareness of all those things. I think there just wasn't a recognition of how critical it was to great outcomes, and that we just had to redesign the system, not just make the diagnosis and not just provide the treatment, but it's important that we really be involved in the whole system. And on that note, when there are no folks from my generation in the room, do you and your classmates feel like we have left you a mess of a healthcare system?
How do I answer that in this room? A mess? No. I will speak with all of my credibility as a student. I mean, in the middle of training, literally thinking about what it is that I am going to do and what is it that I'm going to contribute. I think there is so much that we can do, and I think so many people are already trying to do it, and we just don't know what works yet. And we just are trying to decide between all the options and find something new. My generation, I think we think that anything is possible, and I don't think we're as naive as some people accuse us of sometimes, I guess, in that it's not necessarily easy. We don't necessarily even know what to do yet, but we can figure it out. And I believe that, but I have a lot of learning to do still, and I think my classmates would agree.
Well, one of the great things about Hopkins is that it's an amazing place to follow your curiosity, and it's also a place that gravitates to really, really hard, unsolved problems. So one of those problems that I've been working on is how to transform healthcare from a digital perspective, how to make everything more effective digitally. I'm curious, what's your thought on what are the opportunities there? What's your perspective on how to make this work?
So I do remember a time before Google, which is the quote you always like to send my way. I do remember when we all started using smartphones. To me, that is where we're headed, just period. And we need to embrace that. I know my generation is just ready to walk right into it, and it's just a matter of when the technology catches up, which I think is part of your job, actually. So let's go.
I think if it's okay, I'm going to thank both of you and move on. Peter, I know you must be incredibly proud of Sarah, and Sarah, you should also be proud of your father.
Yeah.
Our next pair are not father-daughter, but daughter-daughter, both alums of our school, Valerie Ratz and Megan Gornett. Megan is the former student, well, they're both former students. Megan is one of our interns in OBGYN. And I wondered if you could talk a little bit, particularly focused on your experience as women in the school and how that might have changed.
So first off, thank you so much for inviting us here today. We are very honored. I look out on the audience and I see all of the women physicians here, and it's just truly an honor, and thank you all for paving the pathway for us. So, Mom, do you want to go ahead and address?
So I wanted to start with, I think that the introduction talking about a Mary Elizabeth Garrett was incredibly helpful. And that was, that concept and her image throughout my medical school years was something that we constantly talked about. Is that something that when you were a medical student that you heard a lot about?
Yeah, I know the Mary Elizabeth Garrett room exists, which we sometimes go to, have a little quiet time sometimes, but yeah.
That's great. I think that because of Mary Elizabeth Garrett, the concept of women physicians, we've had a role in medicine, and a big role, and we bring to medicine maybe a little bit different perspective, and that's why diversity in medical school is so important, and that diversity gives us different perspectives and different ways of approaching medicine and thinking about our careers. And so I'm wondering how you view being a woman physician in medicine and how Hopkins has influenced that.
So it's funny, as my mom and I kind of thought about our talking points for this morning over coffee, we were talking about the concept of the glass ceiling, which for us women is obviously a very important thing. And for her, her experience was obviously very different, which she'll touch upon shortly. But for me, I was like, well, what glass ceiling? As a Johns Hopkins medical student and a Johns Hopkins resident now, again, all of the women in the room have really paved the way for me to have this experience to where I feel that I have every opportunity that is available to everyone else. As a medical student, I was considering orthopedic surgery as my specialty. Ultimately, I chose OBGYN, but I think many women earlier, 30, 40, 50 years ago, probably didn't have the ability to make that choice. Orthopedic surgery was traditionally a very male-dominated field, and they didn't have that opportunity to just make the choice to choose whether or not OBGYN was for them or for whether orthopedic or general surgery was for them. So for me, it was all about the idea of getting to choose and not being limited.
So I think it's interesting, part of what we're thinking about here today is then and now. And what I think one of the things that hasn't changed is that concept of mentors. And I think mentors are so important in medicine. Being a woman physician now where I am, I'm teaching, and I always talk about we need mentors for our academics and mentors for our research and mentors for this thing called life in medicine. Can you comment on how mentors have helped you in residency in your medical school course?
Yes, well, first off, Mom, you were the first mentor that I had.
That's very kind. That was not a setup,
Come on. No, but that was one of the first things that really struck me about Johns Hopkins Medicine was the female professors that I met along the way, again, in every single field that I encountered. My mentor currently is a gynecologic oncology surgeon, and she provides every single opportunity for research and what also it means to have a work-life balance, which I think not just as a female, but for every physician is a really important concept.
Right, I think that's really important. I think in the difference between residency now and then is quite a bit. And Megan's here today after 3 hours of sleep. So unfortunately, despite all our innovation, we haven't figured out how to deliver babies from 9 to 5, right? So we're still up at night.
So the other question I had for you, Mom, was being the Dean of Admissions for another prominent medical school, how has your experience as a woman coming up in medicine shaped how you admit students to medical school or anything?
So I think the most important thing is that this is one of those questions that I answer, it doesn't matter man or woman. It's about loving medicine and looking for the best and brightest people that want to go into medicine. That's what Hopkins taught me. When I came here and throughout medical school, throughout residency and fellowship, there were people around me that loved what they did. They loved taking care of patients. They loved asking the questions and having the curiosity. And that's what I look for today in people who are going into medicine. And I think that should never change. It's always about the best and the brightest and bringing them to this unbelievable career and profession.
I agree. And thank you for having a mother and daughter have a forced conversation up here. So
we're maybe getting along.
I know,
it's
it's
amazing.
great.
It's really good.
Thank you both. I think I also want to say, Valerie, you must be very proud of Megan, and Megan should be very proud of Valerie, who's also winning one of our alumni awards in just a few minutes after this. So thank you both very much. Our next pair are not related, at least not that I'm aware of, but are connected through having each a very inspirational father. And one of those individuals is Awa Sana, who's one of our medical students. I mentioned her earlier as participating in the primary care leadership track. And the other is Jeremy Nathans, one of our professors whose father may be well known to you, a former Nobel Prize winner, who also one of our colleges is named after. Awa and Jeremy?
Hello, everyone. As Dr. Ziegelstein mentioned, my name is Awa Sane. I am currently a third year, rising fourth year in the School of Medicine. I basically grew up in Gambia and have been in the US for about 8 years now. Moved here to start college and have been enjoying my time in the School of Medicine.
I'm Jeremy Nathans. Roy, thank you very much for hosting us. It's a pleasure to be here. Awa has a much more interesting life story than I do. So I'd like to turn the microphone over to her and ask her to tell us a little bit about her journey.
So I basically grew up in a family of 4 children. I was the only daughter. I have 3 brothers. And my father is an accountant by trade, and he studied in the UK for his bachelor's and master's degree, which is where I was born while he was still pursuing his degree. And then I spent most of my earlier years in Gambia, went to school, which I was largely encouraged and supported by my parents. And this was actually a huge privilege for me growing up because it was not guaranteed for all of my peers growing up in that country. And basically, they saw that I was very excited about education and about sciences, and they provided whatever resources they could to help me to succeed and to meet my ambitions. So my final year of high school, basically in thinking about what my next steps would be, I suppose I have always assumed that I would study abroad, just in wanting to follow in the footsteps of my father when he went to the UK to study. And I learned about some opportunities to study here in the US, some others in the UK, but received a partial scholarship to go to the University of South Florida, and that's kind of how I ended up going there. I didn't know anyone in Tampa, did not have any family specifically in that state, but my parents somehow trusted me enough as a 17-year-old to fly across the Atlantic Ocean and to go pursue my bachelor's degree. And I was lucky enough to make that journey with two other friends of mine from high school. And we started together, and I think that was a tremendous source of support for me as I went through my college education, just having the two of them there, knowing that we would support each other and that we understood each other's backgrounds and would be homesick together. So that definitely made my experience in college a lot better. And I studied cell and molecular biology, and have known since I was in middle school that I had wanted to be a doctor and to go to medical school. I hadn't really foreseen the challenges that would present themselves once I started on that journey. I came here as an international student, and some of you may know or have heard that there's limitations to where you can apply as a medical student. And so a lot of the schools that I did apply to were private schools, and a lot of them in top tier schools like Hopkins. And it actually forced me to apply a little broader than I potentially would have. And I'm glad that I did, because it landed me a spot here at Hopkins, and I've been very fortunate to be here.
I have another question for you. What's the highlight of your time as a medical student here?
I would say it's the people that I've been around. I've been involved in extracurricular activities with my peers to do community service, to do recruitment of underrepresented minorities to the School of Medicine. And that has been a really great source of support and camaraderie and friendship for me. And also being in the primary care track, I've been surrounded by like-minded individuals who are passionate about primary care. And just being inspired on a day-to-day basis by people who love what they do and are great at it has been wonderful.
And tell us, you're heading into primary care. What's your thinking about primary care beyond the U.S., and especially back in Africa, where you're from?
So in thinking of my future career, I always do envision being able to contribute to the healthcare system at home in the Gambia. And I think one of the greatest needs is to establish a stronger primary care system. There is one medical school in the Gambia, and there's definitely a need for more trained and skilled physicians to care for the population. And I think providing greater access across the country for basic diseases, infectious diseases, are a huge burden on the population. And so just being able to in my future work towards establishing that type of primary care system where people would have access when they need it and be able to afford it is something that I'm looking forward to working on.
Jeremy, before we transition to questions from the audience, I know your journey was shorter than ours. Could you just maybe spend a short time explaining your journey to the audience, and then we'll open it up for questions?
Sure. Well, I grew up here in Baltimore. I went to Poly High School. You know, in Baltimore, when they ask you where you went to school, they mean high school, not college. And managed to end up in the Bay Area, San Francisco Bay Area for many years. I met my wife, who's right here, Tan, and both of us decided to come here to Baltimore, back home. I actually live 6 blocks from where I grew up as a kid, and my mother, who's in her 80s and in great shape and going to work every day, lives in the same house where I grew up. So things haven't really changed.
Do you want to just talk for 20 seconds about your dad, since Awa is talking about her dad as an inspiration?
Sure. So Dan Nathans was my father. He was the youngest of 8 children. He was the family's last hope for a doctor in the family, so he went to medical school, WashU. And then he spent his entire professional career here, starting in 1962. He was a very thoughtful man, very quiet man, very dignified. And I had a wonderful time being his colleague, in addition to his son, of course. We were both in the molecular biology department together for about a dozen years. He served for a while as interim president of the university and was sort of a King Solomon, you might say. I think many people, myself included, have a system where if they confront a difficult, especially ethical challenge, they solve it by saying to themselves, what would Dan have done? And that is remarkably clarifying.